Good figures in Devon. The most up-to-date figures show the number of new cases dropping everywhere in the county except for a slight increase in West Devon. The infection rate's fallen to its lowest in a month, and Devon's Director of Public Health praising people for sticking to lockdown rules. But Steve Brown says there's still pressure on our hospitals. Dr. Adam Reuben is the South West Coast Chair of the Royal College of Emergency Medicine. Good morning to you, Adam.
Morning, Gordon.
We heard from you a couple of weeks ago, didn't we? You told us that emergency department's under pressure like never before. Have things got a bit better?
I'm afraid the situation is still reasonably bad in the southwest region, to be honest with you. There probably is an end to the tunnel, even if we can't quite see the light there yet. So as you just said, the peak of the cases does seem to have passed now, but what we see with that is that there's an inevitable lag. So whilst the new cases of COVID in the community have started to plateau or even fall, hospital admissions do continue to rise for some time afterwards. And it will be some time yet before we see that death rate fall significantly, I'm afraid.
100,000 now, as we all know. That grim figure was revealed this week. And the Director of Public Health for Devon says the rollout of the vaccination programme going well. When do you think that will start to make a difference?
I don't know the answer to that question, I'm afraid. Clearly, we hope the vaccine starts to have an impact soon, though. As the mass vaccination programme kicks in, we've got numerous centres throughout the southwest. I think you'll see more and more of those elderly and vulnerable patients getting the vaccine, and that has to be a good thing. This is a vaccination programme, the size and scale of which has been quite extraordinary, like nothing we've ever seen before. So I think that will make an impact, and hopefully in the not too distant future.
We've been hearing a number of stories recently in the news, Adam, haven't we, about the pressured staff of A&E and intensive care units around our country, let alone our county. How would you say they're coping at the moment in Devon?
Well, we talked about this a week or so ago. It's incredibly difficult at times, and it's no exaggeration to say that our staff are facing pressures that we haven't experienced before. So working conditions are extremely challenging throughout the departments in the region. Emergency departments are full, flow is poor, we've got prominent exit blocks, so that's difficult in getting patients admitted to the wards. And we've got delays in freeing up some ambulances because of the challenges of getting crews into handover. But the staff are doing what they do best at times of adversity, and that's they're pulling together and they're focusing on the job that has to be done, because that's essentially what we signed up to.
I've seen posts on social media when it was being touted to reintroduce the applause on our doorsteps, and so many medical staff were saying, Adam, we don't want that. That won't help us. What will help us is people wearing their masks, people being a safe distance, people washing their hands.
Yeah, that's absolutely right. I'm not sure how comfortable I feel having people applaud for me on a regular basis. The key to this really is asking the public to follow the government advice, so to stay at home wherever possible. And that's not always possible, but where it is possible, people should do that. They should observe the government guidance, and they should look out for each other and support each other. We'd urge the public to think of the staff working hard in EDs and hospitals and to follow those rules. I think, to be fair, most people are, but there's still a job to be done.
Of course. Do you know, Adam, the daily briefing, we've all seen them, heard them, haven't we? The daily briefing from Downing Street, almost daily. If you were given a spot, Adam, on the daily briefing, what would you ask the Prime Minister?
I'm not sure what I'd ask the Prime Minister. I think the Prime Minister is doing a good job in incredibly difficult circumstances. This has been said many times. But we are genuinely in unprecedented times, and by definition, that means there's no script for how best to manage this situation. This is something that none of us currently working in healthcare have ever seen before. And I think it's fair to say that we've learned an incredible amount about a disease that didn't even exist 18 months ago, about how to manage it and what to do. And we'll continue to learn those lessons along the way. So we've all made mistakes with how we've managed it, but we've learned from our mistakes and we've moved on. And I think it's important to acknowledge that.
That's very honest of you, but I'm sure your honesty, as well as the work of you and all your colleagues, it's just so appreciated at the moment by everybody, and it's difficult for us to express that sometimes, the feelings that we have towards the NHS.
Yeah, and I think, to be honest with you, I think people recognise that. We see that with patients coming into the emergency department. We see how grateful they are. People actually don't want to use our services unless they really have to. And the issue is they still do need to. So, people must still access healthcare if they need it, but do so sensibly.
You take care, Adam, and thank you and all your colleagues for your continued work.
Thank you.
You're very welcome. Dr. Adam Reuben, the South West Coast Chair of the Royal College of Emergency Medicine. Let's catch up